Hi guys, my name is Daniel Dodge. I'm a prenatal and pediatric chiropractor here in Capel, Texas. In today's video, we're going to talk about why get your baby adjusted. Now, a lot of people have the wrong idea of adjusting kids or newborns. They have an idea of what it's like to be adjusted as an adult, and they think that's what we do with kids. But really, we tailor our adjustments for the age group. So we're not going to adjust a newborn the same way we adjust an adult. We use very light, gentle pressure, some sustained pressure. And the pressure is about the same amount of pressure you would use when testing a ripe tomato. It's very gentle. It really looks like when I'm adjusting a newborn that I'm just kind of feeling their back gently, that I'm just kind of holding different places on their head very gently. Kind of looks like I'm not doing much because I use such gentle, light force and slow movements. So why bring your baby in at all, though? Babies go through a really stressful, traumatic experience with birth. It's tough on mom, but it's also tough on baby. There's a lot of force produced with those contractions, and that's a lot of force that's pressed down on the baby's head. There's a lot of downward pressure on that baby's head, and neck, and upper back, and spine that gets distributed. So there's a good chance that that can develop some restriction and misalignment within the spine or in the cranial bones. And especially if the baby is asynclitic, which means their head is kind of tilted and they're not on the cervix perfectly, or if they're posterior, that causes the force to be distributed completely differently in the spine, and it can lead to a better chance of there being a misalignment in the upper neck or in the cranial bones or the back. So it's important to get that checked, because in the upper cervical here, that's where the brainstem is, and that's where the vital centers are, breathing and heart rate. So you want to make sure that there's no inflammation caused from any misalignments that will affect the function of that brainstem and affect your baby's function. You want the nervous system to be functioning optimally. So we want to check that upper cervical to make sure there's no inflammation and no restriction there. There was an old study done a long time ago that showed that upwards of 95% of newborns have some type of upper cervical misalignment. So even if everything goes perfectly smoothly, and there's no problems, nothing comes up during the birth, you still want to get your baby checked to make sure that their upper cervical and their cranial bones are functioning the way they should, and there's no restrictions, and there's no interference in the nervous system or on the brainstem. So it's important to get the upper cervicals checked, but it's also important to get the cranial bones checked. During birth, as they go through the birth canal, the cranial bones telescope over each other, they overlap, and then when they come through, they open back up, and they're supposed to start a nice rhythmic motion. But a lot of the times, this doesn't happen. The cranial bones still stay a little bit overlapped. That motion that's supposed to develop doesn't really occur. So it's important to get that checked, because that helps with cerebral spinal fluid flow and nervous system function. So it's important to have those cranial bones separated, those sutures separated, and the cranial bones going through that normal rhythmic motion they're supposed to. So babies can also have a lot of fascial restriction. I see this a lot of the times with lip and tongue tie. That's occurring more often nowadays. We're having a lot of trouble methylating our B vitamins, which are leading to midline defects such as lip and tongue ties. So we see a lot more of that, and that also is associated with a lot of restriction within the connective tissue underneath the jaw, in the neck and upper cervicals, over the shoulders and upper back. And all that tightness can really affect how the baby nurses and how the baby functions. If everything's tied down, they can't really open their jaw and go through a normal sucking motion the way they need to. So it's important to get that checked, to make sure there's not a lip and tongue tie, to make sure that all the connective tissue is released around the upper cervical, the jaw, the upper back, to make sure that they are loose and able to nurse and function as properly as they can. Problems with this tightness, with jaw motion, can occur because of upper cervical misalignment, or cranial misalignment as well, and those things can really impact nursing. It can affect how well they suckle, and it can cause pain and discomfort during nursing. It can cause them to have to nurse a lot more frequently because they're not getting a lot when they nurse. They're not efficient with their nursing. So it's important to get all this checked, because you want your baby to function the best they can and get as much milk as they need to and have a good nursing relationship with your baby. All of this is really important in those early days. So it's important to get your baby checked. Even if you had a perfect normal birth, that nothing occurred and everything went right as planned, which is not very common, Even if that does occur, you still want to get these things checked, because there still could be a lip or tongue tie or some fascial tightness that isn't going to be affected really by the birth process, but can really affect the nursing relationship. So it's important to get your baby checked if everything went normally, but especially if things were a little bit abnormal, where there was an asynclitic presentation or a posterior presentation, or labor went really long, or maybe even there was a C-section. A C-section is a completely different set of forces on the baby's spine. Instead of that downward force, that downward pressure on their spine, it's a tractioning force. It's a separation in their spine and in their nervous system. Upwards of 90 pounds of force is used to pull a baby out during a C-section. And then you may have some jarring and pulling back and forth to get the baby out. So it's really important after a C-section or after an asynclitic presentation that you get your baby checked, because there's a lot more likelihood that they're going to have an upper cervical misalignment or cranial dysfunction or upper back misalignment that can lead to problems later on down the road. So there's a lot of research behind chiropractic and pediatric care. Research that shows improvement with things like colic and digestive issues, constipation, ear infections. It can improve sleep, it can improve nursing issues, things like reflux, all can be improved because chiropractic helps to optimize the nervous system function. We align the spine, we get the cranial bones moving the way they should, we release the fascial adhesions that are there and the restriction that those cause to allow the body to function the right way. So you want your baby to start off life functioning optimally. Those first few weeks and months of their life have a lot of development and a lot of quick development, and you want them to move through that development optimally with a properly functioning nervous system. So I hope this video was informative and helpful for you. Keep up with us on Facebook and our YouTube channel, and we will see you at our next video. Thank you.